Nutrition is important at every stage of life. From the early years, optimal nutrition ensures children grow and thrive. School years are an important time to develop healthy habits. And these smart decisions should always be encouraged to ensure health and well-being for all, at all ages. Nutrition is particularly important at some stages of life, like during pregnancy. For enjoying a long, healthy life, it is a good practice to have regular checkups and eat healthy diets. Optimal nutrition is one of the greatest gifts you can give yourself and your loved ones.
Dear students, my name is Preeti Khanna and I would like to welcome you all to the course on geriatric and elderly care. Great efforts have been made here to present with you on the topic of geriatric nutrition. As you all know, aging is characterized by diminished organ system reserves and weakened homeostatic controls. With age comes along many physical changes. Once the body reaches physiological maturity, the rate of degenerative change exceeds the rate of cell regeneration. Calorie requirements also decrease with age, although individual requirements vary greatly depending upon the individual activity level and health status of the elderlies. Elderly was once defined as being age 65 years or above, but the growing number of active and healthy older people has caused that definition to expand to include young olds aging 65 to 75 years of age, old olds including 75 to 85 years of age, and the oldest olds 85 years and beyond. The over 85-year age group is the one that is growing most rapidly. Changes associated with normal aging increase nutritional risk for older adults. The incidence of dysphagia or difficulty in swallowing increases with age. Dehydration is one of the most common causes of fluid and electrolyte imbalances in older adults. Skin breakdown is a common problem, particularly in bedridden or immunologically impaired people. Because of the above-mentioned problems, elderly people are at a greater risk of being malnourished. The cornerstone of geriatric nutrition is a well-balanced diet. This provides optimal nutrition to help delay the leading causes of death, for example, heart diseases, cancer, and stroke. Geriatric nutrition applies nutrition principles to delay the effects of aging and disease, also to aid in the management of physical, psychological, and psychosocial changes commonly associated with growing old. Healthcare teams also play a very important role in assessing and coordinating geriatric nutrition care. The candidates attending this course will be highly benefited as the course content is presented in a very easy language with a lot of case studies and real-life examples. This course is very beneficial to those who are willing to acquire a knowledge on geriatric nutrition. The objectives and the key learning outcomes of understanding geriatric nutrition are as follows: need and importance of geriatric nutrition in India, physiological, metabolic, and psychological changes associated with aging, nutritional demands and problems in elderly populations with a special focus on elderly women, dietary advices and guidelines for healthy and active aging given by national and international organizations, factors affecting appetite and various principles involved in food selections, types of the diet in various disease conditions, and most importantly, the importance of nutrition for the caregiver. Additionally, you all will be given the opportunity to raise questions related to the module. We will be utilizing videos, presentations, and online lectures to help you learn better, followed by a short assessment at the end of this module. Looking forward to your kind support. Now let us understand what is nutrition. Nutrition in simple terms means providing nourishment to the body through food. It supports life and helps us to stay healthy. It promotes health and healthy living. Health problems and diseases can be prevented with good nutrition. It helps in recovery and repair of the body. It is critical in special conditions such as illnesses. Balanced nutrition is important for all age groups. Nutrition for the elderly is known as geriatric nutrition. As you all know, countries with a large population like India have large number of people above the age of 60 years. In the last 50 years, the population over the age of 60 years has tripled in India. According to the 2011 censuses, there has been an increase of 8.14% in the elderly population. This increase in the elderly population is the result of fertility and mortality regimes over the last 40-50 years. Good nutrition is essential to the health and well-being for all of us. Our bodies need a well-balanced diet containing essential nutrients and plenty of fluids. This helps in the growth of new cells, maintaining normal body functions and providing energy. For those who are ill or even elderly people, a well-balanced diet helps maintain muscle and skin tissues and prevents pressure sores. A good diet promotes the healing of wounds and helps in coping with physical and mental stress. During this age, frailty also sets in. Symptoms of this include weight loss, decreased appetite, poor nutrition, dehydration, inactivity, and impaired immune functions. In aging adults, nutrition care is not limited to disease management or medical nutrition therapy, but has broadened to have a stronger focus on healthy lifestyles and disease prevention. Now, if we all just look at the health pendulum, we can see that nutrition interacts with the genes to influence health and aging. Also, as you all can see from this health pendulum, nutrition influences healthy lifestyles and prevents diseases. Now, let us move on to understanding the nutritional needs of geriatric women. It is projected that by 2025, the number of the geriatric women in Asia will be 373 million. Particularly important are adequate calcium intake and physical activity, especially in adolescence and young adulthood, by preventing subsequent bone loss or restoring bone mineral density. Now, let us understand the sources of nutrition. As you all know, nutrients provide us with nutrition. Based on the functional classification, nutrients are classified as energy-giving, which includes carbohydrates and fats, body-building, which includes proteins, and protective, which includes vitamins and minerals. Cereals, roots and tubers, and starches provide us with carbohydrates. Pulses, milk and milk products, eggs, meat, chicken and chicken products provide us with proteins. Green leafy vegetables, other vegetables and fruits provide us with the vitamins and minerals. Moving on, now let us discuss about the changes associated with aging. Along with aging, many physiological, metabolic and psychological changes occur which increase the need for nutritional demands. There is also increased risk of chronic diseases, cognitive impairment, dementia and arthritis. Activity level also usually declines during aging. Body composition changes with aging. Fat mass and visceral fat increases, whereas lean muscle mass decreases. Sarcopenic obesity sets in. It is the loss of lean muscle mass in older people with excess of adipose tissue. Together, the excess weight and the decreased muscle mass exponentially compound to further decrease the physical activity, which in turn accelerates sarcopenia. Reduction in bone density, especially in women, increases the risk of fractures. There is impaired dentition. Impairments in digestive and sensory function also occur and can lead to reduced nutrient bioavailability. There is insufficient production of stomach acid. Sufficient stomach acid is required for the absorption of vitamin B12. Dysgeusia, which means altered taste, loss of taste, or hyposmia, which means a decreased sense of smell, are attributable to aging. Many changes are due to medications also. There are skin changes as well. Changes in the taste perceptions also occur, and by the age of 74 to 85 years of age, the number of the taste buds fall by 65% and the sensitivity to salt and bitter taste further decreases. Changes in the sense of smell can reduce the pleasure of eating. Tooth loss, use of dentures, dry mouth can lead to difficulties in chewing and swallowing of food. Decreases in taste sensations and saliva production make eating less pleasurable and more difficult. Cataract, glaucoma, and age-related macular degeneration are diseases of the retina that affect central vision and can lead to blindness in older people. Eyesight issues and arthritis may make food preparation difficult. Moving on, psychosocial factors also exert a substantial effect on the food choices and intake and hence nutritional status of an elderly. As we age, our brain also ages. Stroke, dementia, Parkinson's disease and depression account for most cases of disability in older people. The incidence increases exponentially with increasing age. Among older people, depression often is caused by either conditions such as heart diseases, stroke, diabetes, cancer, grief or stress. It diminishes the pleasures of living, including eating food. It can exacerbate other medical conditions and it can compromise immune functions. It is associated with decreased appetite, weight loss and fatigue. Nutritional care can play an important role in addressing these conditions.
My name is Tithi Prabhakar and I will take you to the next slide of this topic. Factors affecting appetite in old age. What is appetite? Appetite is a person's desire to eat food. Hunger and appetite are two different things and are separate from each other. The amount of food a person eats because of an increased or decreased appetite directly affects their nutritional status. In old age, the appetite of a person can get affected by various factors. Let's look at some of them. Sight and smell of food can greatly affect appetite. If the food is presented beautifully and gives out a delicious aroma, they may want to eat it even if they are not hungry. Good food presentation is important. When food is served according to the likes and dislikes and includes food items which they like to eat, it can stimulate their appetite and cause overeating. If the elderly are mentally and physically relaxed and happy, they like to eat their meals. Regularity in eating is necessary and encourages hunger. A pleasant environment while eating increases appetite and they look forward to eating meals with friends and family. Exercise and physical activity also plays an important role in food digestion, thus encouraging hunger. But just as there are various factors that increase the appetite, physical and mental fatigue along with worry and fear decreases it. Trying to hurry up while eating or trying to eat very fast means half-eaten meals and reduced appetite. An unpleasant environment and depression can also contribute in suppressing the appetite. Lack of physical activity causes digestion problems and impacts hunger and appetite both. Long gaps between meals or not eating when hungry reduces appetite, resulting in malnutrition and deficiency diseases. Let's now discuss an important topic of this module, principles of nutrition in old age. Grains, proteins, fats, sugars and vegetables along with dairy products are the major food groups, out of which at least 3 should be included in each meal for a good nutrition and a balanced diet. Fiber, as we know, provides roughage to the diet and prevents constipation, which is a common problem of the elderly. Fiber helps to keep blood sugar and blood cholesterol levels in check. Vegetables, fruits, whole grains are good sources of fiber. They should be included in all meals. 8 to 10 glasses of water per day are required to stay hydrated. Dehydration is common and can lead to a salt imbalance which can prove dangerous. Keep in mind that they should avoid drinking water late in the evening, as that can lead to frequent urination and disturbed sleep. Essential minerals and vitamins are important and help the elderly stay disease free. Milk, vegetables, fruits are all rich sources of minerals and vitamins. The intake of salt and sugar should be limited for geriatrics and strictly monitored, as some of them suffer from diabetes and high BP. Their food should be lightly salted and sugar should be added within limits. Proteins, as we know, are needed by the body for repair and replacement. Proteins can help prevent injury and help in recovery in the cases of accidents and surgery. Only healthy fats or monounsaturated and polyunsaturated fats such as omega-3 and omega-6 fatty acids found in olive oil should be consumed, as they can prevent heart disease and help the elderly stay healthy. Their daily meal plan should broadly consist of 3 main meals and 2 snacks. A regular diet is a well-balanced diet and can be vegetarian or non-vegetarian. It can be modified by changing the choice of food, method of preparation and consistency of food to suit particular requirements and diseases. For old people who cannot tolerate a regular diet, these modified diets are very useful and help to maintain their nutrition quotient. There are various types of modified diets such as liquid diet, soft diet, bland diet and semi-solid diet. Let's learn what they are. Liquid diet is given to a person when they are not able to chew or digest food. A nutritious liquid diet can keep them well nourished and hydrated. Liquid diets can further be divided into clear fluid and full fluid diets. Clear fluid diet is good for replacing fluid loss in cases of dehydration and can go up to 2 days. It includes tea, coffee, soups, juices, coconut water, etc. A full fluid diet can be given for a longer time and has more variety. It is useful when there is difficulty in swallowing or in the absence of teeth. It includes fruit juices, soups, milks with very nutritious additions as skim milk powder and egg. A soft diet is soft in texture and consistency. It is easy to chew and digest. It can be given to old people having chewing and digesting difficulties. It includes dalia, soft cooked rice, soft boiled egg and potato, etc. The next diet is bland diet, which is low in fiber, salt, spices or masalas and is non-irritating to the digestive tract. It does not cause the common digestive problems as acidity and indigestion faced by the elderly. A semi-solid diet is the softer form of a regular balanced diet. It is easier to chew and swallow. Sometimes in cases of disease as high blood pressure and heart disease, a low sodium or a low fat diet may be given. These are called special diet. Let's learn more about them in our next slide. Diet forms the most essential part in the treatment of diabetes mellitus along with medication. Planning a diet for a diabetic is simple once we have kept a few factors in mind. A diabetic diet should be well balanced, including all food groups but in moderation. It should include food items which have a low glycemic index, which means that they do not get released into the bloodstream very fast, but slowly. High fiber foods as rajma, chana lower the glucose due to their fiber content. Include good protein from dals, chana, rajma, paneer, eggs and fish. Fried and fatty foods and alcohol should be avoided. Add whole grains and millets as jawar, bajra, kodu, which are easily available locally, are much cheaper and very beneficial for diabetics. They have a low glycemic index and help to manage the disease better. Intake of sugar and sweets, mithai, should be avoided. Processed foods as maida, processed white rice and white sugar are best avoided. They have a high glycemic index and increase the blood sugar levels. Encourage them to consume whole fruits rather than fruit juices. Divide their day in 5 to 6 meals of equal caloric value rather than 3 big meals. Include plenty of fluids to stay hydrated. Never allow long gaps between meals or meal skipping. Help them practice moderation in eating, no feasting, no fasting. Uncontrolled diabetes can lead to heart and kidney problems, so manage the disease well. High cholesterol is a man-made disease which occurs due to several factors such as lack of physical activity, faulty food habits, high intake of fatty foods, stress and strain. A diet which provides all the required nutrients without adding to the body weight and helps lower the cholesterol levels can help to manage this disease. A low-fat diet is important to maintain the body weight. The fat content in the diet should be according to the physical activity of the person. High soluble fiber foods as millets, whole dals and vegetables help lower the cholesterol levels. Garlic and methi seeds or fenugreek seeds are effective home remedies passed on through generations which help in lowering the cholesterol levels. Processed foods made of maida as breads, buns should be limited, or they can be combined with vegetables to increase their fiber quotient. High fatty foods as mayonnaise and hydrogenated oils should be slowly stopped in the diet. Fats from animal sources as ghee and butter and animal products as salami, liver, red meat as mutton and pork should not be included. Monounsaturated or good fats as olive oil and sunflower oil should be used for cooking. Walnuts are a good source of omega-3 fatty acids and should be included in the diet if possible. Skim milk, low-fat curd and egg whites can be included as protein sources. Fried snacks as samosa, kachori, puri and namkeens should be avoided. Apart from this, the elderly should be encouraged to move around and exercise as much as possible. High blood pressure is a common problem of the elderly, but a few changes and modifications in the diet can greatly help to manage their disease better. A hypertensive diet should take care to balance the sodium and potassium levels in the body. Banana and coconut water are rich sources of potassium and can help maintain this balance. The intake of sodium, especially in the form of table salt or salt added to food after cooking, should be avoided. Example in raitas, buttermilks and salad. Pickles, papads and chutneys are a part of every Indian household. Limit their quantities due to the high amount of salt in them. These are also called the hidden sources of salt. Bakery products as cakes and pastries have salt added to them while cooking, which cannot be tasted or seen, so limit their use for better management. Ready-to-eat foods available in the market as salami, sausages, salted meat and fish and pre-cooked packaged foods where salt may be used as a preservative should be limited in quantity. Preserved and canned foods as salted butter, processed cheese contain high levels of sodium. They are best avoided. Include fresh and home cooked foods where the salt level can be monitored and controlled wherever possible. avoid alcohol and smoking as they increase the blood pressure. A common problem of old age is missing of a few or all teeth. Many elderly adopt dentures or false teeth to be able to eat their food. They have to be careful in choosing the type and texture of the food they eat and avoid. Choose foods that are soft in texture, easy to chew and can be cut into bite-sized pieces. Foods that are coarse or hard like dry nuts, sticky foods made of rice flour or foods that crumble easily as bakery products should be avoided. When choosing vegetables, special attention should be paid to cook vegetables as carrots and pumpkin or kaddu well. Leafy vegetables as spinach and mustard leaves or saag have tender shoots. Cook them well till they are soft. Vegetables as lotus stem or corn or bhutta are best avoided. When eating non-vegetarian foods, choose skinless and boneless chicken and fish, avoiding chewy and tough meats. For elderly having dentures, non-vegetarian should be minced, shredded and boiled. Soft cooked eggs, paneer and tofu are good alternative protein sources. When choosing fruits, avoid dry and hard fruits as pineapple, guava, opt for soft and succulent fruits as banana and mango. They can be chewed and swallowed easily. Fruits like apple, papaya can also be grated. Let's now learn about the regional grains of India, millets. Millets are indigenous Indian food grains and their food value and benefits are being rediscovered. They are a storehouse of nutrition and health benefit. Let's now discuss some of the benefits. Most of the millets are non-acid forming, non-glutinous, highly nutritious and easily digestible. They have a low glycemic index and are gluten free. They are good for diabetics and people suffering from celiac disease. Millets are rich sources of minerals and vitamins. They are a rich source of fiber and can help overcome malnutrition. Millets are widely available in our country. They are relatively cheaper and easily available in local markets in all the states. A wide variety of millets is grown in India. The millets commonly grown in India are jowar, bajra, ragi, kangni, kodru, etc. They may be known by different names in different regions of India. Pearl millet or bajra, which is a high source of proteins, may also be known as sajje, sajalu, kambu and kambam. Foxtail millet or kangni, which is rich in minerals and vitamins, may also be called thinnai, kirra, thinna, navane, so on and so forth. For more details, you can refer to your study material. Millets have immense nutritional value and benefits for the elderly. Make them a part of their daily diet in the form of porridge or dalia, upma, khichdi, etc. Maintaining the health and nutrition status of the elderly and the disabled is the responsibility of caregivers, whether they are members of the family or friends or relatives or even professional caregivers. Caregiving can be a stressful task and a demanding profession. It can be very taxing on the body. It is time consuming and can extend over long periods of time, sometimes months and even years. Over a prolonged period of time, it becomes very important that the caregivers look after themselves and take care of their food and health, giving due attention to their nutritional needs. This will help them stay healthy and fit so that they are able to look after the elderly properly and also perform their duties better. Here are a few nutrition tips for the hardworking caregivers. Plan and prepare your meals in advance so that you eat healthy and nutritious meals and do not skip eating or cooking food for lack of time. Include seasonal fruits and vegetables in your diet. They are easily available, much more nutritious and cheaper than cold storage varieties. Always opt for easy to cook meals which are nutritious as vegetable khichdi, oats, upma, Adding vegetables to them will increase their nutrition quotient. Keep healthy snacks with you at all times. Nutritional superfoods as banana, eggs, jaggery and til laddus are very good options. This will ensure that even if you are unable to find time for a proper meal, you are still able to eat healthy. Fruit and vegetable smoothies are easy to drink and can be consumed even while looking after the elderly or commuting. Avoid junk food and fast foods as Maggi, burgers and samosas. They do not provide you with any nutrition and can affect your health status. Apart from food, personal health and hygiene is also equally important. It ensures you do not fall sick often and, more importantly, do not pass on your infection to others, especially the elderly, as geriatrics have lower immunity. Daily baths, trimming of nails and wearing clean clothes is important. Do not underestimate the importance of good sleep. Take adequate rest. It helps to maintain health and reduces stress and strain. It also increases our immunity. To conclude this module, if the elderly eat well and use food to manage their disease and age-related problems, they will age well, facing lesser problems and diseases. Their life will be easy and they will stay healthy and happy. Food has healing powers and helps us stay healthy and nourished. Good and correct food can act as medicine. Eating well helps in the rejuvenation of body and mind. Healthy aging begins from childhood. Good eating habits and balanced meals can keep us away from disease, ensuring a healthy old age. Old age is like a second childhood and the elderly are like children. Treat them with love and respect.